Hello everybody and welcome back to 5 on Friday, CEENTA's live question and answer session. Today we're joined by Dr. Ernest Bhend, who practices in our South Park and Matthews offices. Dr. Bhend, thank you for joining us.
Yeah, thank you for having me.
Our pleasure. Today Dr. Bhend will be answering a variety of questions about eye care. Some of these questions were submitted by you through our Facebook page. So our first question is, what are the symptoms of ocular rosacea? And I suppose we could start with, what is ocular rosacea?
Sure. So ocular rosacea is actually, to back up, rosacea is a condition where you get some inflammation in the skin of the face. And sometimes it'll be across like the cheeks or onto the eyelids. Ocular rosacea is when it involves primarily the eyelids and sometimes the front of the eye, the skin on the surface of the eye. We call it the conjunctiva. So sometimes people with rosacea will get involvement of the eyelids and the eyes, and it can cause things like redness and irritation, that sort of thing.
Okay. Our next question is, my glasses broke, but I found an old set at home. Is it okay if I wear them for a while?
Yeah, typically an older prescription, even though it may not be as sharply focused, it won't hurt the eyes as far as an old prescription. Sometimes it may just not be strong enough, or it might not be the right prescription, but it certainly won't hurt the eyes to wear an older pair of glasses. Okay,
great. Our next question is, how can I convince my daughter not to take a nap in her contact lenses?
Good question. Sometimes it's harder to do that. One of the biggest things we tell patients with contacts is you don't want to sleep in the contacts because it can increase your risk for infections on the surface of the eye. You can even get what's called an ulcer on the surface of the eye, and that can cause quite a bit of damage to the eye. You can even lose an eye from an ulcer like that. They've found that sleeping in the contacts, even these newer ones that say that they're okay to sleep in, it still puts you at much higher risk for infections of the eye. So we tell people not to sleep in their contacts because of that primarily.
Okay, great. The next question we're asked is, my eyes have become very sensitive to light since I got pregnant. Should I be concerned?
The most common cause of that kind of sensitivity is probably some dryness on the surface of the eyes. Sometimes during pregnancy or other hormonal changes that can make your eyes more dry and more sensitive. Probably it's not going to hurt anything as far as the eyes go, but we do recommend using the artificial tears more frequently. And on the artificial tears, I tell people to use them as often as they need to, but just try to avoid any that say they get the redness out of the eyes. The Visine or clear eyes, those can actually irritate the eyes more, so we try to avoid those. But you can get those artificial tears over the counter at any of the pharmacies, and there's lots of good brands on the market. Using those as much as patients need to will help with any dryness or sensitivity.
Okay, great. All right, and our last question is, do you have any suggestions how to keep my eyes from drying out when I'm on my iPad?
Yeah, it's another good question we see a lot. When we're working on a computer, an iPad, or a phone up close, and we're concentrating on what we're looking at, we don't blink as often. And so sometimes the eyes will get more dry. So you could use some artificial tears as much as you need to keep them from getting dry, but also trying to blink more frequently, just making a conscious effort to try to blink from time to time. When you're doing that can help with that dryness and keep your eyes more comfortable.
Okay, great. That's all the time we have today for 5 on Friday. I'd like to again thank Dr. Bhend for joining us.
Thank you.
If we didn't get to your question or you asked a question during the live session, we will answer it in a blog on our website. Keep an eye on our social media for a link to that blog and for announcements for our next 5 on Friday. If you'd like to make an appointment with Dr. Bhend or any of our eye doctors here, call 704-295-3000. You can also fill out a contact us form on our website, which is wejustmakesense.com. And thank you very much again for joining us, and we'll see you again soon.
Thank you.